In the next week, my administration will be announcing some different ways that members of the legislature, as well as the people of Alabama, can have direct impact into some of the different options that might be available. Today, however, is the next step in what has seemed like a long and difficult process of reopening our economy, while at the same time remaining true to the belief, the fact that, y'all, this is a serious, deadly disease. As Dr. Harris said yesterday, our numbers are not as good as we would hope. And in some cities and counties, Montgomery being one of them, there are some very legitimate concerns with a large number of people being hospitalized, filling our ICU beds. And this is not only a cause for concern, but it's something we're certainly going to keep a strong eye on in the following days and weeks. Now, in all fairness, all of the patients in ICU are not COVID-19. So if you've had a stroke or a heart attack or been hurt in a car wreck, certainly you need to be in an ICU bed. Regretfully, many of our nursing homes are still a hotbed of activity for COVID-19. And that's why neither Dr. Harris nor I can, with a clear conscience, allow things to return to normal as it relates to reopening our nursing homes and hospitals to visitation beyond compassionate care situations. There's also more troubling news on the economic front. Tomorrow, Secretary of Labor Fitzgerald Washington will announce Alabama's unemployment rate for April. It seems like a lifetime ago when our unemployment rate was at an all-time record low of 2.7 here in the state. But when more than 500,000 people filed for unemployment during the past 2 months, and more than $1 billion has been paid out in unemployment compensation, folks, that's a lot of hurt and a lot of pain out there. On the positive side of things, we have some good news. This week, the state of Alabama, and in particular, the Department of Public Health, inked a deal with two of the biggest technology names in the world, Apple and Google, to use their contact tracing app to track those who may have been exposed to COVID-19 using Bluetooth signals. Alabama, North Carolina, North Dakota, and South Carolina are the three first states in the United States that have joined some 22 countries around the globe to join hands with these two global giants in hopes of helping our people learn how to, when and where they may have gotten contacted or exposed to this virus. And hopefully this will become an important tool in the toolkit to slow the spread of coronavirus by using what almost every Alabamian has in their pocket, a cell phone. Entering the stay-at-home order in April and the current safer-at-home order, which we're now in, has always been an attempt to slow down the spread. We knew we would never be able to eliminate it, but we wanted to slow it down. The drastic measures of the last 2.5 months have been out of a need to slow the spread and help prevent a surge of our hospital ICU beds. Obviously, in the state, some are experiencing higher rates than others, but however, statewide, we have not exceeded capacity, and everyone who needed a ventilator has been able to receive one. Currently, there are medical experts all over the world working on finding a vaccine. And for the record, I want to let you know I will not be at all surprised if a vaccine was created right here in Sweet Home, Alabama. However, we cannot sustain a delayed way of life as we search for a vaccine. There are many viruses that we live with and have worked necessary precautions into our daily lives. And similarly, it's now time that we move forward and further open our state and live with a new normal of incorporating COVID-19 precautions into our routine. Now, as it relates to the changes in the current order, let me get right to the point. Just as we've had to learn to live with the flu and other viruses for which there is no known cure, it's not realistic to think we're going to be able to keep everyone totally isolated from each other forever. To that end, effective Friday, May 22nd at 5 p.m. and running through July 3, we're going to expand the number of businesses that will be allowed to reopen while maintaining a 6-foot distance, and by adding an extra layer or two of prevention and precaution on those who own these businesses as well as those who frequent these businesses. This will have the net effect of expanding our recent Safer at Home order with 3 caveats. The first is, if things don't get worse, and I certainly hope and pray they don't, then we're going to continue putting personal responsibility on each and every individual citizen. Personal responsibility also extends to the store owner, the summer camp operator, the hairstylist, the youth sports coach, and pastors. It takes all of us, y'all, being vigilant and adhering to these social distancing guidelines in order to stop the spread of this disease. And I'll just tell you, I sure miss being with my friends, going to church and having breakfast at Dirk's. But I've learned how to hold Zoom meetings, speak virtually to a Rotary Club, and I'm going to do my first drive-by birthday party later this afternoon. We can all do our part. However, if we start going in the wrong direction, then we reserve the right to come back in and to begin to reverse course. Secondly, although we're expanding the list of places that can reopen, we're also adding important additional requirements on social distancing and sanitation that we all must adhere to. As Dr. Harris and I keep saying, this disease is deadly, and it is not something that we can take lightly. And finally, for those who just aren't comfortable going out to your favorite establishment and acting though everything is back to normal, we get that. Clearly we get that. And you're right. Things aren't back to normal. And in fact, we probably don't yet know when the new normal is going to look like.